My name is Emily Larson, Mayor. Really happy that all of you are here. Thank you for making time to prioritize the information we want to give out to the public, to businesses, to residents, to tourists in relation to a mask mandate in the city of Duluth. Today, actually just moments ago, I signed a declaration of emergency and will be requiring a mask mandate for the next 30 days in the city of Duluth. It applies to people ages 5 and up. It does exempt child cares, which is something that we did in the previous mandate. I want to talk a little bit about how we got here, why we are here, and kind of position a little bit what you can expect moving forward. First of all, as Kate referenced, there has been a lot of discussion about both masks and COVID-19. It would be really nice if we were not moving into our third year of a pandemic, but here we are. I think what the data shows us and what we know is that we're really at an immunization weak point of a pandemic. What we really need are for people to get immunized, and I'll talk about that a little bit later. But we also need to use the tools that we have. And while there has been a lot of discussion, it's really important to me that you and the public and our residents and our whole state really know and understand. I don't make public policy by counting emails. I don't go through and count who said what, how many are in one direction. I don't make public policy based on commentaries in the newspaper. I don't make public policy based on social media or harassment or picketing at my house or any of the other bullying that can often happen. I make public policy based on information and data. Since Monday night, when the council chose not to move forward with a unanimous vote in support of a mandate, I've been working with the governor's office, with our healthcare providers, with mayors across the state, with administrators across the state. My first phone call on Tuesday morning was actually with Governor Walz, where he talked about the announcement that would be coming out yesterday. Emergency relief, $40 million going directly to hospitals to help support nursing and healthcare staffing coming in. And it was really important to me that Governor Walz got the day that he needed to make that announcement to help the hospital systems that you're about to hear from prepare for that information, to prepare to be able to staff up. I know exactly the feedback I'll get as a result of this emergency power. I know that there will be people who will be grateful. I know there will be people who wish this would have happened. I know there will be people who will be oppositional, who won't agree. All of that is fine. What I'm here to do is create public policy that supports public health. And you are going to hear from public health experts who are going to talk about not just the Omicron and what is happening currently with this incredible spread, but our staffing levels. There are multiple times in the city of Duluth that we inconvenience residents for public health and worker safety. And I'll give 3 quick examples. In the aftermath of George Floyd, we created a curfew that was inconvenient, that sent people home from whatever they had plans to do, interrupted their personal lives to go home so that the police could keep this community safe. We trusted the police. And we trusted that they were in our corner for public safety. Multiple times a week, just even, I believe, earlier this week, we closed down streets when there's a public safety emergency. When there's a fire at the Esmond, it's inconvenient for business owners to be closed, for residents to not be able to get around, to be inconveniencing you on your way to work. And we do it for public safety because our staff and public safety experts have asked us to do that. We know it's inconvenient and we know it's intrusive on your life, and it's still the right thing to do. That is how I see this mask mandate. I understand that it will bump into the choices that you would like to make with the freedoms that you have, and we are still being implored upon by public health safety experts who are asking us to do this for them and for us. What we are seeing in this surge, we can talk about how everything's unprecedented. And we know that there will be future surges. We know that there have been past surges. What is happening now that's very acute is that we are seeing staff shortages that are scary, that are detrimental, that will impact your ability to, potentially your ability to get the kind of health care that you need in an emergency that is not Omicron related. We are seeing staff and healthcare professionals who have spent they are going on their third year. They have spent 2 full years managing a workload and healthcare and public health of a pandemic, despite the fact that people are making choices to not protect themselves and them. This is the very least we can do. So what I'm proposing is a 30-day mask mandate. It will go into effect at 5 p.m. tomorrow. Should City Council choose to enact a separate emergency order following that 30 days, they can do so to create an additional mask mandate. But I want to talk a little bit also about how people can report if there are concerns, and we'll get to the data, and I just know that this is some of the stuff that you need to hear as well. We will be enforcing this in the same way that we did with the previous mask mandate, which means that there is the possibility of misdemeanor charges, of violations and licensing conditions. People can refer concerns that they have to an email address, which Kate will provide, masks@duluthmn.gov. Mask@duluthmn.gov. And we will continue to monitor how things are going. We will continue to work with our healthcare providers. We take your health seriously, and I would fully expect, based on the outcome of the council meeting on Monday, where the decision was made to not move forward with a mask mandate, but confirmation of the work that we are doing on an executive level to protect the public health of this community, that all 9 city councilors would publicly also support the need for this mask mandate, the powers bestowed by the executive order to do so, and to confirm that this is the right direction for this community. We need as many people moving in the same direction as possible.
On behalf of St. Luke's and our community, I want to commend you for issuing this mask mandate. You know, masking is one of the most effective tools that we have when it comes to preventing the spread of Omicron. It's especially important right now, given the prevalence of disease in our community. And it's really not that much to ask. We're currently seeing a surge in the number of people affected by COVID. I would say if it is soon to surpass what we experienced not a year ago, or not last November, but a year ago, November. So this is a dangerous time for all of us. At St. Luke's today, we have 26 patients hospitalized with COVID, of whom 9 are in the intensive care unit, critically ill. The vast majority of our hospitalized patients with COVID are unvaccinated. And that gets me to the next point. Vaccination is one of the other main tools that we have. Vaccination and getting your booster shot, if you can. Please, if you haven't done it yet, make an appointment. There's a lot of vaccine available, and it truly is effective in helping to prevent the spread of this disease. As the mayor alluded to, staffing has become a crisis. At St. Luke's today, we have 162 employees out, and over half of them have COVID. These are breakthrough infections. They're keeping our staff from being able to provide the care for you that we want to. And again, it's related to this degree of community spread. As you can tell, this is a serious situation. And we're hopeful that it won't be too prolonged. But we do have this effective tool, the mask, that we can all do. It's a small thing. It protects you. It protects our friends and our neighbors. Most importantly, it protects those around us who are most vulnerable, and those are the people that end up in our hospitals.
So many of our caregivers and our employees who have been on the front line of this pandemic for almost 2 years are just physically and emotionally exhausted. They are really grateful and look forward to the relief that this announcement will bring. This mandate will save lives by slowing the spread of COVID-19. We know that the Omicron variant is spreading almost unchecked through our communities. By slowing the spread, it will also ease some of the strain that health systems like Essentia Health and St. Luke's are experiencing right now, who have been operating at or beyond capacity on almost a daily basis. And this beyond capacity status is making it difficult and dangerous on our ability to provide the kind of immediate and acute emergent care for our patients and our people in our community who need it. The Omicron variant is threatening to shut down many aspects of our daily lives. This might affect our local small businesses, our schools, and wearing the mask is one of the tools we have to slow the spread. And we know that wearing the masks works. It decreases the spread of respiratory droplets and therefore protects the person wearing it, protects the people around the people wearing it.
Our rates in St. Louis County and in Duluth, as Dr. Deelen said, have been really skyrocketing over the last couple of weeks. We're very close to where we were in terms of case rates November in 2020, before we had a vaccine available to us. So the Omicron variant is very contagious. It's spreading really quickly, and we're seeing that in our case rates. I'm guessing everybody here knows multiple people who are infected with COVID, including me. And we have had three pediatric hospital admissions in St. Louis County in January. That is compared to 4 in last month and 5 in the month before. So it is concerning. We hope that our hospitalization rates do not follow as they have in previous waves, where we've seen them increase after we see case rates go up. We certainly know that layered strategies work at controlling community transmission. Vaccine is our biggest tool in our toolbox, our most effective tool, but vaccines alone, as we know, don't prevent community transmission. Layered strategies is the best protection and best mitigation strategy we have for control of the pandemic or mitigation of the pandemic. So we all have a responsibility to follow public health recommendations. The CDC and the Minnesota Department of Health recommend that we all mask up, universally mask up, when our community rates are as high as 50 per 100,000 cases over a 7-day average. In Duluth specifically, we're about 15 times higher than that. So we strongly encourage everybody to wear masks across the county.
As many of you know, earlier this week, the council had a discussion about a proposed short-term mask requirement that was on our first meeting of the year. 7 of the 9 councilors voted in support of moving forward with that. But as has been reported, that process of passing an emergency ordinance requires a unanimous vote. And so ultimately that did not take effect as law from the council process. However, at that meeting, the council also voted unanimously to approve a resolution in support of exactly what we're here today for, which is Mayor Larson exercising executive powers to safeguard our community as needed during the pandemic and partnering with the public health experts. And I think that's all citizens can ask for, is that elected officials make decisions based on data and science and not politics. And that is exactly why I stand here in support as the council president today, owning this decision as well with Mayor Larson. And I would ask my elected colleagues as well to, I'll reiterate what the mayor said, I would expect and hope for public messages of support. And I appreciate Councilor Randorf, Vice President Kennedy, and Councilor Tomanek, who are here today as well. And I just want to say that everything has a time and a place. This is a 30-day window here that we're talking about. This is short term. This is not in perpetuity. And I would ask, even if you aren't thrilled about this prospect, that nobody likes to wear masks. But let's hope that our business leaders, our community leaders, our elected leaders, and just folks throughout the community can come together in moments like this rather than divide each other. And I would ask for our support to do what we can to keep everybody safe over the next month here.